So, in regards to your relationships with your coworkers, changing the subject again, um, can you give a situation where that relationship with a coworker was challenged? I know you did bring something up.
In my previous job, I did have a personal relationship with my coworkers outside of work, and then, of course, a professional relationship. And unfortunately, that barrier did get crossed, where the personal relationship came into the professional workplace, and it was hard. It was difficult. I had to look within myself and realize that this is work. This is a professional environment, and the people who suffer are actually the clients when there's tension within a department, when there's tension between coworkers. So the issue was resolved shortly after that, and that was the last time that it happened, because I focused on myself and focused on my clients and realized that nobody wins in that situation.
So you're saying even though there are different relationships with coworkers or colleagues and patients, they can still affect one another in the health
Yes,
environment or
exactly.
healthcare environment. Um, what else? In moving jobs, or having different backgrounds, is there a professional termination process when ending relationships with patients? I mean, being that you start with them, you build the relationship, and then you have to.
Yes, definitely. I know in my previous job, I actually worked with children who came over from Central America. I would counsel them, and with each of my clients, I had about 12 clients. Each of my clients, I began the termination process. There was one client in particular who I had been counseling for about, I want to say, 3, 4 months already. He had been at this shelter, and that termination was a little more difficult because we had built a rapport. I met with him twice a week, and of course the termination process with him was a little longer. It was over a 2 3 week span, as opposed to a week, 7 days, 8 days. And so, but of course that the termination process has to be there in when switching jobs with each of our clients.
Do you ever find in those relationships with patients where your emotions are more involved in that, I guess, in a particular patient over others?
I will say in my past experience, like I said, with that child that I was counseling for 3 to 4 months, I did have more of a connection with him because I knew him, because of his story, because we didn't know what was going to happen with his future. It wasn't. It was more of a I was worried about him. I didn't know what was going to happen to him, as opposed to the other kind of relationships that we hear about, where it's affectionate and emotional, things like that. But I think definitely we have those patients who we care so much about their well-being as social workers that it is sometimes we do find it that it entangles, with the professional and the personal level.
Well, thank you, Lily, uh, for your time on the interview. What advice would you give other healthcare professionals entering the healthcare setting regarding patient relationships, what you've seen, experienced?
First of all, I would say, get a pen because it's a lot of information and you're going to need to jot it all down because you're not going to remember it all. I would say that it's very rewarding knowing that you've helped these people when they can't help themselves. Client self determination, it's awesome because you can see it here, and you get that feeling of the satisfaction of knowing that you helped that person. I would also say that healthcare is booming right now, and it's busy and it's nonstop, and there is no downtime. So it's very rewarding. It's very enjoyable, but it is fast paced, and it is it is an industry that's booming. Um, as far as the patient relationships, it's a very rewarding one, and you know, a lot of these people don't know how to help themselves, and me as a social worker, I find a lot of gratitude knowing that I'm able to help the patients and build a relationship with them, get to know them, and get to know their stories and everything that they've been through, the sacrifices that they've made, the challenges that they've faced, and you know, every day I'm challenged. I'm challenged with meeting these people and getting to know their personalities and helping them as best as I can. So.
What about the challenges?
Yeah, the challenges that I encounter, you know, insurance challenges, barriers, income barriers, resources, transportation. It's just so many challenges that we as social workers face, and the patients as well. So you have to have a lot of patience, right? A lot of patience, and you know, you have to have the heart.
Alrighty. Thanks, Lily.